Hello. Welcome to week 12 of HSR 340. We're going to be talking about prevention and harm reduction this week. I hope everybody had a great Halloween. I hope you got lots of candy, including the best candy that they make, the Almond Joy, is the perfect candy, just in general, not just Halloween candy, but candy as a whole. So you are free to email me to disagree with that, but you would also be wrong. And so you're free to be wrong. You are allowed to be wrong. And just know that Almond Joy is and will forever be the best candy, period. So hopefully you had a good week, and we're turning the corner into November. Got one more kind of big month of book learning stuff, and then we'll be kind of done that first week of December. So home stretch here, kiddos, and finish strong. So before we get into the meat of the what we're talking about today, I do want to take a little bit of time to talk about November, which is Suicide Prevention Month and Suicide Awareness Month. Um, and just tell you a little story. So this one will be a little self-indulgent. If you want to scrub ahead, and it's kind of a personal story that I'm going to tell, and you're not really interested, which is fine. You don't have to be. You can scrub ahead whenever you see the slide with the big idea. That's when we kind of pick things up. It's the one with a lot of yellow words. But if you don't mind to sit with me for a second to kind of give an audience to suicide awareness and suicide prevention. So, um, I moved up here in 2011. I grew up in southeastern Kentucky, and grew up pretty sheltered. I grew up, I kind of had a situation where a lot of decisions were made for me. I didn't really have to make a lot of choices for myself. I just kind of went along with the next thing just because of how things were in southeastern Kentucky. You just don't really have to do a whole lot of thinking. You just go do the next thing. And so, um, once I moved up here, it was difficult to kind of know, well, what's the next thing for me to do? Because I'm out of that. I'm out of the system. I'm out of the thing that I know, which was my childhood and the area that I knew. And I was away from my family. I'm an only child. So, I didn't have kind of anybody up here. I had a couple of friends from childhood that were up here. We all kind of moved in together at the same time for a year, but one of them decided to go and get married, and then the other one decided to move to Atlanta, and so I was up here kind of by myself and working, and there was just a lot of stuff that happened at one time. Had some relationship things go on. I was in kind of a toxic relationship situation, and that was bad. And then stuff at work because of that toxic relationship situation that had an impact on me, which affected my work. I my parents were not didn't really have much contact with me, and anytime that I would try to talk to them about how I was feeling, it would just be, well, Jordan, you just need to be better. You need to work harder. You're not doing what you need to do. And you need to go to church, and that would fix all your problems. And so, um, I got in a situation where excuse me, I was really struggling. And I really struggled, excuse me, to, I was in kind of a dark place. I'll be honest with you. Um, I felt very alone. I felt very scared. I felt like a failure. I felt like I didn't really have anybody that cared about me. And I'm 20. See, this has been 2012. So I'm 27, 28 at the time. Just turned 28. Um, and kind of everything culminated to where I just decided that I should also add I was drinking. I don't identify as being in recovery, but there was a period of my life where I drank basically every day, just because my feelings were so overwhelming. So I kind of got to a point to where I didn't want to be here anymore. And November 6th, 2012, it was a Tuesday. I sort of made a commitment to myself that the next day, November 7th, was going to be the day that um, you know, that I kind of checked out. And I wrote letters, um, goodbye, um, journaled, um, just kind of expressed a lot of. I go back to it and read it from time to time, especially this upcoming week, November 7th, is this upcoming week. Um, and just I felt very alone, and I felt like no one cared, and I just didn't want to be here anymore. And so I had a couple of things I needed to do the next day. Um, for whatever reason, I decided that even though I was going to check out, that I had two patients that needed some stuff. One had to go to the Social Security office, and the other one needed medication. So I was working out in the field, and so I took my one guy to the Social Security office, helped him with his benefits, and then as I was on my way back to the office, while I was at the Social Security office, I sent a text message to a friend of mine to express that I was sorry for what I was going to do, and I don't know if it was them. I don't know if someone else just kind of caught a vibe. I don't know what happened, but when I got back to my office, there were three members of the Cincinnati Police Department that were waiting for me. And I worked on the fourth floor, so I walked all the way up to the fourth floor. They called me in. My boss called me into a meeting room, and it was there that I was taken in handcuffs to Deaconess. I asked, "Can I just? I'll go. Can I just not be in handcuffs?" And they're like, "No, we have to do it this way." And I'm like, "Okay." So I was escorted in handcuffs out of off the fourth floor of a building and taken in the back of a police car to Deaconess Psychiatric Hospital. It was connected to the University of Cincinnati, and it was there that I was treated, and I was seen and talked to some psychiatrists and talked to a couple social workers and got some help. Um, and it brought me some hope. After I, received treatment, I unfortunately lost my job and had to start the process of rebuilding. But I had some direction, I guess I could say. So I started seeing a therapist. I had not seen a therapist, but I started seeing a therapist, and I took some medication that really helped me get through a tough period in my life, and it helped. And I started to really do the work that I didn't know that I needed to do. And so I tell you all of this to say that it's okay to not be okay. I was never really given that permission, that it's okay to struggle. It's okay to need help. It's okay that things aren't going perfectly. I was never given that permission, and I didn't know that that was an option. But I'm telling you now that it's okay to not be okay. And so I decided to stay and continue to decide to stay. There are times in which it's still a struggle from time to time. Not really with the suicidal thoughts; those have kind of gone away, which is good. But there are times where it gets overwhelming. Even as a therapist, and I'm really good at my job, and I'm proud of the work that I do, and I do enjoy teaching. Hopefully, you guys are having a good experience with this class. Because I care about this, and I care about all of you, and I care about the work that's done here, and I want it to be good, and I want it to serve not only you but the patients that you're going to be seeing one day. That piece is very important to me. This isn't just information for information's sake. This isn't just a class for you to get the grade and move on. This is something that can fundamentally impact the lives of individuals and families for generations to come. And that's the work that you're going to be doing. That's the work that I do. And so I care about this stuff, and sometimes it can get overwhelming. Sometimes it can get to you, and you start to wonder: are you doing a good job? Are you serving the people like you want to serve? And are people getting what they need? And so it can be overwhelming sometimes. But I come back to it's okay to not be okay. It's okay to struggle. We can sit with that. It doesn't have to mean anything. It can just mean maybe you just need a little support. Maybe you need a little, boost, or to just sit with it and let it pass. I mean, there's so many different things there. So I say to you that it's okay to not be okay. And if there are moments, as especially as you get into this work, or especially as you explore what this field can be or what you want to do in this field, that it can eat you up if you're not careful. It has a way of doing that. So you have to make sure that you're taking care of yourself, because for as much empathy as you can have, you also have to have empathy with yourself. And sometimes that can be really difficult, right? Just from some of you that have emailed me, I can tell you're high achievers and you want to get the grades and you want to do well. And that's great. But there's going to be a point where there aren't metrics for you to know how you're doing. You have to be able to be there for yourself, because you're not always going to be a professional student. So if you ever experience a time where you're feeling overwhelmed, talk to somebody. Reach out to me. I won't be your therapist, unless you're not my student, because that's a dual relationship. But I won't be your therapist, but I can connect you to people that are really good. That's part of the networking that we have here. If you're struggling with stuff, or a family member struggling with stuff, like, resources are out there. Don't be afraid to ask. It's not embarrassing. It's something that we all go through. I wish that you all could know, if you struggle with depression or struggle with anxiety and you feel alone, I wish I could tell you just how not alone you are. I talk to people and they think that they're the only ones going through their problem, when they don't know that the two people that came right before them talked about the exact same thing. So, help is out there. You're not alone. You matter, right? Here are just just the general pick me up, some warning signs, and then the other big part is raising awareness. I mean, I play video games with my two close friends, the one that moved to Atlanta and the one that got married. And I this is my character. Her name is Lifeline, but it's like life imitating art, imitating life. Like, I'm not really good at shooting the enemy, because I don't have that kind of hand-eye coordination, but I'm really good at running in and saving my teammates after they've gone down. And this little semicolon, which is your code word for the week, by the way, is semicolon. I guess I shouldn't do it that way, because I told you if you could skip. So some of you probably skipped. I'll do it in a second. But semicolon is your code word that will show up on your quiz in a couple of weeks. But um, but I put that out there to raise awareness for people, that if they're struggling, that help's available. And I'm proud of the work that I've done. I'm proud to be able to do this. I am proud of a lot of things now that I was not able to be proud of before. So it's okay to struggle if you're struggling. It's okay to be overwhelmed from time to time, but don't suffer in silence. Reach out. People care, and we're here to help you. Okay, so um, that's my little PSA. Thanks for listening. Big idea. No matter what section or subsection of this field you go into, you will need to find a balance between abstinence and harm reduction. More specifically, you will need to be well versed in both to effectively treat patients that you work with. So, as you start work in this field, and it's kind of gone away a little bit from when I first started, but like at the beginning, abstinence was kind of like that's the only recovery that's out there. But there are other options, there are other forms. The biggest thing sometimes that we can do is prevention. Prevention can be huge to help reduce the impact or the harm or um, reduce the effect that someone experiences when they use. It can also be a way to generally reduce the amount of struggle and difficulty and pain that someone experiences. Now, um, the um, the key in treating is finding that balance between when do I really promote this like abstinence stuff and when do I kind of talk about the harm reduction. And I need to be well versed in both because you want to be able to treat the greatest amount of patients. Okay, so that's kind of the big key for today. So we're going to talk about a couple different types of prevention. So primary prevention are includes young people who have not yet tried the substance or who may have tried it a couple of times. All right, so it's that primary first stage stuff. Okay, before we've even got started. Secondary prevention are for people who have tried various drugs and are seeking to prevent cross addiction. So I've started to do some things, but I don't want it to bleed into other areas. So I'm using cocaine. I don't want to. I don't want to turn that into a cross addiction into something else, like another substance that I would use. And then tertiary prevention is relapse prevention or follow up. So we're trying, somebody has found recovery and now we are trying to help them stay in that path and follow up, kind of as needed. Okay. So let's talk about the thing that solved drug addiction. So I don't even know why we're having this class because the DARE program solved everything. It started as a program. And this is, by the way, this is primary prevention that we're talking about. I say that tongue in cheek, but you'll see the DARE program has actually evolved, and it's actually really good now. But when I was in school, we had the DARE Lion. Before that, it was the DARE Bear. But drug abuse resistance education, we all went through it around the 4th, 5th, and 6th grade. It started as a program in Los Angeles in the 1980s where undercover cops would buy drugs from high school kids. Now, it was originally supposed to be taught by medical professionals, so someone like me, but the law did not, the local law enforcement did not really like that because they wanted to be tough on crime, tough on drugs, because again, this is the 1980s. As you remember from earlier in the semester, this is where Reagan kind of started with his just say no. So we wanted to be tough on drugs. A medical professional is going to probably be safer, with kind of talking about the medical impacts and blah, 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 blah. But the law enforcement in the area in Southern California did not really like that. So they were the ones that actually took over and would, try to buy drugs from high school kids. And that ended up getting them into trouble and punitive, right? So it had two main focal points, though. It was to build self-esteem and decision-making and also to resist peer pressure. And as we know, it completely solved all of the problems because it was connected to Nancy Reagan's Just Say No campaign. By the mid-90s, it was present in 75% of schools in America and a multi-million-dollar organization in and of itself, around $200 million revenue generated in 1995, according to DARE's own estimation. So it quickly became a big deal, especially connected to this, where it's law enforcement teaching it. And so for me, it was Officer Stinson in the 5th grade who came in and would talk about a lot of these things to us as kids. And so you see law enforcement coming in and talking about, stay away from drugs. And the goal there is, well, we're going to be tough on crime. We're going to be tough on drugs. Well, it didn't work as you could probably imagine. In fact, in some cases, it had a boomerang effect, or we could also say like a paradoxical effect, where kids actually found that they would use even though they were told about the dangers of using. So you would have students that would learn about what marijuana can do in heavy doses, and they'd be like, wow, marijuana can turn real life into cartoons. I want to do that, right? And so parents thought that simply having a authority figure tell kids not to do drugs, they wouldn't do them. And how often has that worked? Turns out DARE had no measurable effect on teenage drug use. In fact, this was an idea that they had, right? I'm sure you all remember, those of you that are in your 20s, um, you probably didn't have stuff like this because they became self-aware. But back in the 90s and the early 2000s, this stuff was like pretty prevalent. That you get something like this pencil, like, I'm too cool to do drugs, and then kids like, cool to do drugs, like, you see, like, something starts out with good intentions, but it turns out to be this kind of funny thing, and it doesn't work in the way that you think it's supposed to work. Because again, the thing was like, well, if you have the adult person stand up there and say don't do drugs, oh, okay, well, I'm just going to follow orders. Well, since when has that worked for teenagers? Not much. And also, they would have you act out these like skits, and the skits would just be like, you know, hey man, do you want to do drugs? And then you'd have this other person over here like, no, I don't want to. And then they're like, but I thought you were cool. I am cool because I don't do drugs. I'm going to go play basketball. Like that. And that was supposed to solve drug stuff, but that's too simplistic. That filters everything down into simple morality choices. And as we all know, it isn't that simple. So, what does work? Well, what they're doing now, they are promoting decision making instead of just learning. And interactivity is best. We want to focus on the things that show evidence. If you take my 450 class for the diagnosis and treatment of substance use disorders, the main focus is evidence-based practices, like what actually helps and what actually works. This class is just to kind of introduce you to these things. But if you decide to take 450, which you should, it's a great course, I'm not biased at all, that you're going to be taking what this material is and applying it in real life situations using evidence-based practices, because that's what works. Those are the things that are important. It isn't morality. It isn't just vibes. It isn't feel. It's what does the research say, right? And the research says if you meet a student where they're at and you don't like try to just tell them what to do, it tends to work best, because not every person is going to have the same life situation, and not every person is going to be faced with the same stuff. And especially kids at that age, they don't really have the prefrontal cortex designed to be able to think logically through a lot of things in this way. A lot of it is emotion. So refuse, explain or not, avoid or leave, right? They've even kind of changed what DARE stands for, as you can see down here. Define, assess, respond, and evaluate, right? Not drug abuse resistance education, but let's define what this is, assess what's going on, respond accordingly, and then evaluate what happened afterwards, right? So learning how to be interactive with some of this stuff is best, rather than just, here are drugs, don't do them. Okay. So outside of prevention, we've got a few other things that we can use. So this would be more secondary prevention, right? So harm reduction strategies. I showed you that a few weeks ago with the thing in Green Bay. So syringe or needle exchange. We actually have one of those. We have a lot of those, but there's a standalone location in Dry Ridge, Grant County. And there is also a mobile unit in Kenton and Campbell County. Now, what happens is someone has intravenous needle use, and now we have a dirty needle, right? Or a contaminated needle, I would say. Sometimes people reuse those. Obviously, that could increase the rate of infection. Obviously, if somebody else uses a previously used needle, that could increase the rate of their infection. It also increases the rate of HIV/AIDS transmission. It increases the risk of abscesses. It increases the risk of just all kinds of medical issues that can come about. Well, What if you could take your needles and take them to a standalone location and trade them in for those that are not contaminated or clean or fresh needles? Now, there's an argument there that is, well, you're just promoting drug use. Well, I mean, if somebody's caught up in addiction, you don't really have to promote it. Like, it's already there. And so, the other thing is that it isn't they just say, okay, here's your needles, have fun using them drugs. They give them resources and offer detox or residential service for that as they walk in. The last time I talked to our needle exchange people were probably 5 or 6 years ago. But even in that space, they said that 40% of people that walked in would seek detox or residential on that day that they walked in. That's pretty good, right? So 4 out of every 10 will make a decision to go to treatment. Even if it was 10%, I think that would be great. But 40% is outstanding, right? We also have supervised injection sites, and that is this middle section here. Okay, so basically, somebody goes and they buy their street drugs, and they come into one of these little kiosk looking things here. As you can see, there is they can get you know the things that they need, the different paraphernalia needed to use their drug of choice. If they decide to use intravenously, there are syringe containers that can dispose of their needles safely, and also prevents reuse. They also have fentanyl test strips to test the substance a person's required, and there are medical professionals there that, in the event that there is an unintentional overdose or there is a medical emergency in some way, they can immediately be treated. That's pretty cool. So to date, with these supervised injection sites, and they're peppered all over the United States, no deaths have been reported. Right? Because there's medical professionals there that can help them, and also they get the chance to go to treatment. Because again, at every point of all of these harm reduction things that we're talking about, they get resources for recovery. And if these didn't exist, they probably wouldn't have that same amount of exposure to what is available. Okay. And then also paraphernalia vending machines. I showed you a little bit of those a couple weeks ago when I went to Green Bay, but these vending machines offer, crack pipes, um, that that are not made out of glass, and so they will not shard or shatter, and you just simply dispose of them. It's safer to use. It prevents the risk of infection. It prevents any unintentional infection that can happen with contact to somebody else. And it's much safer, right? So it's, again, what we're saying is we're not condoning the drug use, but we're saying, if you're going to use, can we do it safer, right? So that's what some of these prevention things are. We'll also talk a little bit about naloxone. So naloxone is it's called an opioid reversal agent. And the original Narcan is a nasal spray. It's actually very simple now. It used to be that you had these two different parts that you had to put together, twist, and then it could be used. Now they just have it like this, and you can get these. I mean, you can go to your pharmacy right now and pick them up. Um, and it's an opioid reversal agent. I have a couple. They're only good for like 6 months, and you don't want to keep them in your car. But I've got a couple that I have, that I keep with me, just in case, because you never know. and they are widely and readily available. There's another one called Evzio, that is a needle. It's a little more expensive, but it's just as effective. And Evzio, you pull the top off of it, and it's an auto injector, and you put it in somebody's thigh, and it reverses their opiate, whatever they've used. It's a little bit stronger. Yeah. So those are your options for naloxone, which can be helpful. In most places, I know at NKU has several of these. University of Kentucky has several of these. I mean, there's several around. An opioid rescue kit, or Nalox boxes. I had to go get my Dutch Bros. If you've not had Dutch Bros, It's amazing. So, Nalox boxes tend to have, obviously, as you can see here, Narcan in them. There's also rescue breathing kits. That's what's in here to help someone with rescue breaths if they've, as they experience their overdose. Maybe you have to help them with CPR and breathing. That's what's oftentimes in here, and additional services to help people to reverse an opiate. So again, would be considered secondary prevention, which is good. So we need these prevention and harm reduction strategies connected to safer use kits, and so these are little baggies, little kits that have several different things in them to help with safer use. Again, instructions here to aid in reducing the risk, fentanyl test strips, and cottons here, and yeah, these down here are a little more advanced because they have the actual syringe box to put in to what I would assume would be at a needle exchange place. Sometimes in here they will have, as you can see, bandages. This one doesn't have bandages, so this has got bandages, I'm sure. Some swabs that would help to reduce the risk of infection. Sometimes they will have chapstick, which can help if somebody is smoking crack or huffing. The mouth can get very dry and can bleed, and so there's usually chapstick in there to help with that. But these are just little kits that will help to, if again we're just saying you're using, we're not going to judge it. We're just going to make sure that you are using in a safer manner. Okay, using in a safer manner. So again, harm reduction in clinical practice. Abstinence might not be a goal. Sometimes mild drinking is a goal. Mild use is a goal. Recreational use is a goal. In fact, I'm sure you saw the Scrabble letters after my name, but the one where I had to get this one, the IC and RC test that I had to take, it gave a vignette, and the vignette was, John is using cocaine every so often. It does not appear to be a problem, yet his wife is in your office asking for what is going on, what is most likely the case. And it was like substance abuse, substance dependence, has a problem, and it's just recreational use. That was the answer, recreational use, because that's what it is. Just because someone is using a substance does not mean that it's problematic. Again, these are all just chemicals that are affecting our brain and our body. What are we attaching morality to any of these drugs that someone is using? So sometimes the reduction of the behavior is a goal. And remember to be mindful of radical acceptance. I may not completely agree with what you're doing, but I am going to radically accept you as a person and help to treat you where you're at. That's really what that harm reduction is designed to do. Okay. So remember, discussion board this week, screening tools, assessments for next week. And then we're also going to look at the Scott Hall story. So Scott Hall was a professional wrestler in the WWE, WWF at the time, and WCW. And he had a problem with drugs, and you're going to get to look at his story and see what you think. So where could some of these prevention and harm reduction things have come into play with Mr. Hall? And could they have been implemented to help him? So hope you have a great week. Enjoy this week. Your code word for the week, if I didn't mention it before, is semicolon, SEMICOLON, semicolon. And that's all I got. So as always, Canadian geese are defended proof that evil exists. Live mahalo. I will see you next time. Okay, bye.